Good morning. I'm Dr. Roshni Patel. I am the director of the breast program at Jersey Shore Medical Center. I just moved here from New Hampshire this past February. In my previous role, I was responsible for setting up a comprehensive breast program for the patients who received their care at Dartmouth and Manchester, New Hampshire. I did my residency training at Morristown Memorial Hospital in Morristown, New Jersey, and then went on to an oncology research fellowship through Temple University in Philadelphia. This was followed by a clinical fellowship in breast surgical oncology at Fox Chase Cancer Center. I also have served as the American College of Surgeons New Hampshire State Chair for the Commission on Cancer for 7 years. The reason why the metastatic breast cancer community is important to me is that many patients are surviving longer. We develop new therapeutic strategies and develop a better understanding of tumor biology. And we also are getting a better understanding of the interaction of the tumor cells within the surrounding microenvironment in the body. I have a colleague and friend who has survived metastatic breast cancer for over 20 years. Her personal story was very compelling to me. And when I first met her, I found that she's an advocate for cancer prevention in patients with any stage or type of breast cancer. And she also advocates for patients with other types of cancer as well. There are times when surgery may still play a role in patients with stage 4 breast cancer. Sometimes it may be a form of palliative treatment or what we call local control to help prevent further symptoms such as bleeding and infection. Some patients also will only present with one small area of metastatic disease in their body, and they'll still receive their systemic treatment and then surgery. In the patients with very little metastatic disease, there's been found to be a survival benefit. The other role that has been important to me as part of the treatment team is connecting patients who have metastatic breast cancer with cancer rehabilitation, which is a growing field. This is a multidisciplinary group that includes physical and occupational therapy to help with treatment-related fatigue and safe pathways to exercise. This team also includes palliative care, nutrition, and integrative medicine. I just want to clarify that palliative care is not end-of-life care, but this is a group of people who helps with symptom management and quality of life. I'm very fortunate to have some of my wonderful colleagues join me today. First, we have Dr. Harriet Borowski, who joined Hackensack Meridian Medical Group as the Medical Director of Breast Imaging for Riverview Medical Center and Big Shore Medical Center. Dr. Borowski and her team of fellowship-trained breast imagers at the Women's Center provide the highest level of experience in comprehensive care and breast health for women of all ages. They focus on early detection and the diagnosis of breast cancer. They also help with benign breast disease as well. Prior to joining HMH, Dr. Borowski was a medical director for breast imaging and the medical director of philanthropy at Mills Peninsula Medical Center in San Mateo, California. She's currently a member of the American College of Radiology, the Society of Breast Imaging, the American Society of Breast Disease, and the National Consortium of Breast Centers. Among many other accolades, Dr. Borowski has been recognized as a top doctor by the San Francisco Magazine. She's also chair of the breast imaging section of the National Consortium of Breast Centers. Dr. Catherine Campo joined the Hackensack Meridian Health Multidisciplinary Breast Program in 2014. She completed her fellowship training in oncology at St. Luke's Roosevelt Hospital and Beth Israel Medical Center in New York. Prior to this, she completed her general surgery residency and internship at the University of Medicine and Dentistry of New Jersey School of Osteopathic Medicine. She is a 2-time recipient of the Frederick G. Mealy Scientific Paper Award at UMDNJ. Her recent physician presentations include breast cancer, what is high risk, and advances in breast cancer diagnosis and treatment. She was also actively involved with both Riverview Medical Center and Bay Shore Medical Center, achieving accreditation from the National Accreditation Program for Breast Centers. Dr. Stephen Windsor is a hematologist oncologist at Riverview Medical Center. He is board certified in medical oncology and internal medicine. Dr. Windsor earned his medical degree from American University of the Caribbean School of Medicine in the West Indies. He then completed his residency at Hackensack University Medical Center. He also earned his distinction of chief resident in his final year. He then completed a medical oncology fellowship at Yale University School of Medicine. He plays an integral role in the multidisciplinary care role of his patients, and he is well respected in our community. So I will start off with a question for Dr. Borowski. You're working to deliver a more personalized approach to delivering the news of a cancer diagnosis throughout our system. So when a patient requires diagnostic imaging following a mammogram, how do you help them to manage their anxiety around those next steps?
Okay, well, thank you for that question and thank you for the introduction. Certainly, and without a doubt, some of the highest anxiety and stressful touch points in healthcare encounters for women is first and foremost just having a mammogram, but especially being called back for additional views and ultrasound, which is also known as diagnostic imaging, after a lesion or abnormality is found, and even more so when a biopsy is recommended. I think the possibility of a breast cancer diagnosis is something which is real for all women because, as we all know, breast cancer is so common and it touches all of our lives in one way or another. Quite naturally, there's fear and anxiety surrounding discomfort regarding additional views, cost of additional imaging, the possibility of a cancer diagnosis, and how might that alter the course of their lives and that of their loved ones. So we support our patients through these really stressful and high anxiety encounters by first and foremost providing very prompt reads. So we read screening mammograms within 24 hours and call women directly when they need to come back in. Throughout the process of being called back in, we acknowledge with them just how stressful and anxiety provoking the process is. We try to communicate their expectations each step along the way, like, now you're going to have extra views, the doctor is going to look at it, and you may need an ultrasound, and then the doctor is going to go over everything that is found and what the next steps are and recommendations. If a biopsy is recommended, we explain to patients what that means, how it works, what they can expect. They meet with our nurses and we try to schedule that procedure as soon as possible. We give them access to the doctors and their care team when a biopsy is recommended. And we always end the conversation with, we're going to let your doctors and your care team know about this and that we're scheduling you for this procedure. So we try to guide them through the process with compassion and sensitivity.
What role do you play in helping patients who have metastatic breast cancer?
In those patients that have metastatic breast cancer, some of them, it's really become a chronic illness. And I saw a patient on Friday who came in because she felt a lump in her reconstructed breast. So we imaged her. She needed a mammogram on her contralateral breast. So we are seeing them. We see some women who are living long with metastatic breast cancer, and therefore we're still screening them and addressing any issue or problem that may come up.
Thank you. Good morning, Dr. Windsor. How do you help your patients build their care team and create trust and ensure they believe they're receiving all the support and information available to them?
Hey, good morning. And again, thank you for allowing me to be with you this morning. In terms of building a care team, I mean, this is always an individual subject. You know, we assess each of our patients. We look at their symptoms. We look at their performance status, what their goals of care are. We look at their social situation and what kind of support services they have at home. And then we utilize, many of our other practitioners and subspecialists, imagers like Dr. Borowski. We use our surgeons, our radiation oncologists, pain management specialists, and interventional radiologists in assisting with their care. We also utilize whatever other support services the patient's needs require. In terms of trying to establish trust with our patients, I try to explain the treatment plan and provide them with written information about each of the medications that they'll be receiving. I try to give them time to process and allow them time to ask questions. I always encourage my patients to obtain a second opinion, preferably at a university-based or tertiary cancer center. And in terms of our practice, just the standards of care, we do follow the standards as outlined by the NCCN, the National Comprehensive Cancer Network.
Thank you.
In terms of support, I think education is really the key. We utilize our nurse practitioners, our nurse navigators, our oncology infusion nurses, and our oncology pharmacists, and our social service department. But there are still plenty of other educational resources available to patients outside of our facility. We refer patients to the American Society of Clinical Oncology, the National Institutes of Health, and NCCN, who all have wonderful websites with a lot of patient care and access to patient information. Foundations like Susan Komen, the American Cancer Society, also have very valuable, patient care information.
And I think that's really important that you do that, because there's so much information available on the internet, and you're giving them reliable, evidence-based information, so they can make an educated decision about their treatment plan.
Yeah, it can certainly be overwhelming. There's so much information available on the web, and I think it's our job to sort out, and help the patients process what's there. It's interesting. I think some of the most educated patients that I see are the breast cancer patients that come in. They come in well researched and well informed, but again, there's just so much information, and I look at it as our role to try to process, the good information and the important information from things that could potentially do them harm.
And I'm going to ask Dr. Campbell a quick question. Dr. Campbell, as a part of a metastatic breast cancer patient's care team, how do you work together to keep an open dialogue with the patient about building the treatment plan while considering all treatment options and making the informed decision?
So I think it's really important that I discuss the treatment plans with all of their treating physicians, especially the medical oncologists. Sometimes we'll even present a patient's case at the multidisciplinary breast conference. That way we can get the opinions of several specialists. And then with the surgical intervention, it's really important that any surgical treatment doesn't delay their medical care. And to discuss whether or not to do surgery for a patient, it's very patient specific. Sometimes we have to do it in order to obtain an accurate diagnosis. If for some reason they're not able to have a percutaneous biopsy, they might need to have a surgical biopsy to get a more accurate diagnosis, especially to obtain the receptors. And other times we have to do surgery due to progression of disease or if a wound has formed. But this is all important to talk with all the other doctors to determine when's the appropriate time to do that. And what's really important is to know when it's not helpful to do surgery for a metastatic patient. And that can be a difficult discussion, but it's important for them to know that the medical treatment is going through the whole body, whereas surgical treatment is just working locally. And so I really stress that to them, and that we've also discussed this with the whole team, and that would be the best approach for them.
Thank you, Katie. Dr. Windsor, I think it's hard for all of us to keep up with emerging treatment options. There's so much more new information that's coming out every day as we begin to have more and more understanding about tumor biology and interactions with the body. How do you stay current with all the options available to your patients, including the clinical trials that may be a fit, and also communicate these potential treatment plan changes to them?
Well, I think that's a great question. As you said, therapies are constantly evolving, and staying current can, truly be a challenge. Right now, there are more than 80 FDA-approved drugs for the treatment of breast cancer. And what we've seen in medical oncology over, certainly the past, I'd say, 1 to 2 decades is a paradigm shift. We're moving away from using, chemotherapy and taking more targeted approaches. So what we really focus on is looking at the pathology and and the uniqueness of each of the cancer biologies. We look at the patient's receptors, we look at their genetics, and we look for any potential targets that might be actionable, things that we can tailor their treatment plan to, and use drugs that will simply target those areas and avoid some of the side effects. As the information is updated constantly, and myself, my colleagues use peer-reviewed journals. We attend multinational society meetings. There's meetings with the American Society of Clinical Oncology, the AACR. It's a very large Miami breast conference, which is going on for nearly 40 years. We not only talk about treatments for breast cancer, but also survivorship. And I think this is very important to our metastatic breast cancer patients. We have multidisciplinary tumor boards every week at our facility, where a group of specialists get together to discuss each case in detail. We all participate in CME activities and lectures in our area, and certainly web updates are a primary important source of information for what we do. In terms of clinical trials update constantly. They open, they close, and you really need help doing this. And I think this is where we utilize our nurse navigators the most. They are instrumental in helping us to determine if there's a clinical trial available for our patients, if they meet the entry criteria, and to facilitate getting the patient on the trial. because some trials are available, within our own facility, intergroup trials, but sometimes there are unique trials that are only available at certain centers, and we always try to facilitate our patients' ability to get on those studies as well. In terms of communication with our patients, we see our patients regularly, and we do objective assessments to see how well our treatments are working. So I think when the time comes that we need to change and move on to a next therapy, I try to sit down with the patients, discuss what the options are, and formulate a plan together, because they're the bigger part of this. And I think what they feel and what they have to say is extremely important.
I always enjoy our society meetings, because I found that when we go to these conferences, a lot of them are very multidisciplinary now, as opposed to just being subspecialized. So I know I learn a lot from those in our tumor board discussions.
Absolutely.
Dr. Borowski, one last question for you. How do you help support your patients handle depression and feelings of lost control and grief, and provide support and resources at the time of diagnosis?
I certainly think the complex, unique, and very personal psychosocial challenges of living with metastatic breast cancer, while balancing ongoing treatments, maintaining a quality of life and a sense of well-being for patients and their families, cannot be underestimated. We are really fortunate to have a dedicated nurse oncology navigators that support our patients and their families by connecting them to invaluable resources that we have here in the hospital, that we have in the network, and beyond. We have a support group that meets once a month, and invited speakers are brought in. This is virtual at the current time. We have a program called Reach to Recovery that pairs a patient with someone similar in terms of age and their journey through the breast cancer diagnosis and treatment. We offer integrated health programs offering complementary therapies and strategies to cope with chronic pain, stress reduction, managing anxiety, providing nutritional support, counseling, and access to alternative therapies. We do have a private therapist that patients can be referred to. And then we also offer access to online resources that are available free of charge. There is one called Cancer One, which provides access to oncology social workers and support groups. And the other is Living Beyond Breast Cancer, that provides access to specific support groups. And we're always looking for ways to grow and support our patients with metastatic breast cancer and their families.
Thank you. Dr. Campbell, what support and resources are available to patients that deal with the side effects like fatigue and insomnia, weight loss, and pain?
Yeah, so there's a lot of support and resources available. We have an integrative health department, which is a really great resource. They have a lot of different options for the patients, including acupuncture and a lot of other resources. I know that they meet with the patients and determine what their needs are and specialize it depending on what they need. A dietitian or nutritionist is also helpful, especially if a patient's dealing with weight loss or any issues with changes in their taste due to treatments. If they're experiencing pain, then we might have them see pain management to help come up with some better treatment options for that. It's also important for them to meet with a therapist. They're dealing with a lot of stress during this time, and that can help them to manage that. And then there's a lot of support groups available. Some of them are in person, some are run through the hospital, but there's really been a lot of virtual or online support groups that patients have been able to find a lot of help from.
Thank you. Dr. Windsor, one last question for you. How and when is it appropriate to incorporate complementary and integrative therapies?
Sure, another great question. So complementary therapies, I think it's important to start early and, in the patient's treatment plan. The complementary medicines can include diet, nutrition, mind-body approaches like acupuncture, massage, Reiki therapy, art therapy, aromatherapy. It's different from integrative medicines. Integrative medicine, I believe, is how we blend standard care and these complementary therapies. And we're very fortunate at our facility to have an excellent integrative medicine department. Our other sister facilities, Jersey Shore University Medical Center and the John Thurber Cancer Center, likewise have excellent integrated medicine departments. But I think using complementary strategies, and it's really very applicable to patients with metastatic breast cancer, because the goal of therapy is not only prolonging survival, but we're trying to improve and preserve patients' quality of life. Because I think the most important thing is you never want the treatment to be worse than the disease itself.
Thank you for that, Dr. Windsor. Do you guys have any other final thoughts that we might want to share with our audience?
Okay, well, sort of on a personal note, 40 years ago, when I was a senior in college, we lost my mother to breast cancer. At that time, there were only a handful of chemotherapy drugs, and there was only one hormonal drug that had any activity in this disease. As I said before, today there are over 80. Over the past several decades, I've been fortunate to see amazing advances in the treatment of metastatic breast cancer. I feel very optimistic for the future and what we can accomplish together. And I believe we'll one day look at treatment of this exactly the same way we do as for other chronic illnesses. In the meantime, I'm very privileged because I'm able to help a group of people whose courage and dedication and perseverance are always a great inspiration to me.
I just wanted to share that when I started my clinical practice over 2 decades ago, one of my very first breast cancer diagnoses was in a lovely 50-year-old who thought she had a breast infection, but instead was diagnosed with a fairly advanced form of breast cancer called inflammatory breast cancer. That would have been a lethal diagnosis when I was a medical student and when I was in my residency. But thanks to therapy, targeted treatment, therapies, I'm proud to say she's alive and well and in her 70s. And I'll never forget an incredibly vibrant 40-year-old woman that I diagnosed with breast cancer, which was found to be metastatic to her liver at diagnosis. And she is alive and well 10 years out and coming in for her screening mammograms, which is amazing. I do think it takes a cohesive, multidisciplinary team of physicians, nurse navigators, social workers, access to alternative treatments and therapies to really provide the unique and challenging care that's essential for women with metastatic breast cancer and their families. And I'm grateful to be part of a team that provides that care. Thank you.
Thank you. Katie, any thoughts?
Yes, so I think patients who are going through metastatic breast cancer, it's a very difficult time, but it's important for them to feel comfortable with their treating physicians, and they should feel like they can have an open discussion with them, and that their physicians are all also discussing their treatment among each other, and that there's a lot of different options available for the medical treatment and also for the emotional and well-being, a lot of ways to help them to get through this.
I also echo what all of you said. I think this is an amazing group of patients that we get to take care of. It takes a lot of courage to go through what they're going through. And I certainly have taken care of a lot of patients that have been in my practice long-term with metastatic breast cancer. And again, just their spirits and attitude always blow me away. So honestly, it really is a privilege to help with their care. And I'm really lucky to work with a wonderful group of people since I moved to New Jersey, and I really enjoyed doing this discussion with you guys today. So I definitely would like to thank you guys for joining me today. And I would like to thank the Komen Foundation for allowing us to be very part of this very important discussion. Thank you.
Hi, my name is Becky Carmichael, and I have breast cancer. First of all, with COVID, I skipped my first year ever of having a mammogram, and my doctor and my insurance company both let me know that I was overdue. When she sat me down after both biopsies and after the MRI and said, yes, there is cancer in that node. I think that's when it finally hit me. Oh gosh, now we're going to be dealing with breast cancer. Everything's kind of had to stop, and that's been a bit difficult. I miss my friends, my weekly coffee or tea or lunch with the group of women that I always went out with every week. Jim and I will be married 51 years next month. Sometimes I think I rely on Jim too much. He has been there from the very beginning. He sits in the bathroom to make sure I'm not going to fall while I'm in the shower. I mean, he's really taken really good care of me. I don't know if I could have a better caregiver. As soon as I got my diagnosis, that was one of my resources, is to go in and look at Susan G. Komen and see what's available and see other women that post things. There's other women that have been through things, and you really do learn a lot from what they've gone through. Take care of yourself, get your mammograms, don't count on feeling a lump. You're number one, so act like it and don't skip a mammogram. I would like to thank everyone for helping Susan G. Komen in the fight against breast cancer with your donations and your support. Thank you.